Welcome to the Sky Therapeutics podcast. I'm your host, Tara Torres, a clinical nutritionist, researcher, educator, and consultant specializing in areas of weight loss, autoimmune disease, gastrointestinal disorders, metabolic syndrome, and other obesity-related conditions. I help clients improve their health through proper functional nutrition, professional-grade supplement protocols, exercise recommendations, education, and support using a personalized, evidence-based approach. At Sky Therapeutics, we offer functional nutrition solutions for chronic disease and help our clients develop sustainable lifestyle habits that will last a lifetime. As a friendly reminder, the information and opinions provided here today is to be taken as general information only, and you should always contact your personal physician or other qualified healthcare professional if you have any questions about your personal health and wellness. Welcome to episode 2. This week, we're going to be talking about the prescription medication called Semaglutide. This prescription has been growing over the last couple of years and gaining popularity. While it originally started as a type 2 diabetes medication, it was recently approved for weight management. And so, since so many people are beginning to use this medication, and I work collaboratively with multiple different types of doctors of different types of specialties, I'm often seeing these patients come into my office, and I just wanted to address what this medication is. I wanted to weigh in on the pros and the cons. I want to talk about the costs. I want to talk about the different forms, injectable, pill, long-term side effects, adverse effects, and what this looks like. Do we titrate on? Do we titrate off? So it just made sense to bring on Tifany because she has been prescribing this medication, and I wanted her to weigh in on her experience and what she's been seeing with her patients. So Tifany Brown is a certified family nurse practitioner with over 10 years of nursing experience, and 5 of those years she's practiced as a licensed advanced practice nurse. Over the last couple of years, Tifany has leveraged the advancement of technology and practiced via telemedicine in over 30 different states. She has a passion for empowering others to change their lives, and expanding her reach with a virtual practice has significantly impacted that passion. She likes to focus on vitamin deficiencies, weight loss, and improving overall healthcare literacy to give people the tools they need to make informed decisions about their health. So if you or somebody you know is interested in a prescription like Semaglutide for diabetes or weight management, I would encourage you to listen in so that you can know all the facts and make the most informed decision for yourself or your loved one. So without further ado, here we go. Hi, Tifany. Thank you for joining me.
Hello, thank you for having me.
Where are you at today?
I am currently in Denver, Colorado.
I love it. I love it. The joys of having a virtual practice. I love following your journey and your business and all the things that you do. And I'm just so excited to get your professional experience on the weight loss medication semaglutide today. For our listeners, I want to go over semaglutide as a medication. It belongs to a class of drugs known as glucagon-like peptide 1 receptor agonist, or GLP-1 RAs. It's used primarily to treat type 2 diabetes, although it's been studied for its potential in weight management. Let's start with a review of GLP-1 and what it does. So GLP-1 is a naturally occurring hormone produced in the intestine, specifically in the L cells of the small and large intestines. It plays a crucial role in regulating blood sugar levels and has several important functions in the body, particularly in the context of glucose metabolism and appetite regulation. So some of the primary functions are blood sugar regulation. So GLP-1 helps regulate blood sugar or glucose levels by stimulating the release of insulin from the pancreas. Insulin is a hormone that facilitates the uptake of glucose by cells, therefore reducing blood sugar levels. And GLP-1 also inhibits the release of glucagon, which is another hormone that raises blood sugar levels by promoting the release of glucose from the liver. It also slows gastric emptying. So gastric emptying is basically the rate at which the stomach empties its contents into the small intestine. So by delaying this absorption of nutrients, that includes glucose, which can slow glucose spikes and nutrient absorption in general. It also regulates appetite. So GLP-1 will promote the feeling of satiety and fullness after eating by reducing food intake. So, this effect is one of the main reasons GLP-1 is used in medications like semaglutide because it can help reduce obesity. And then there's also a thought that it might have neurological effects because we find GLP-1 receptors in the brain, and it may help regulate appetite through the central nervous system. And then we also know GLP-1 has a short half-life in the bloodstream because it's rapidly broken down by an enzyme called DPP4. And this degradation helps prevent excessive insulin secretion and other effects. So it's worth noting that GLP-1 is just one of several hormones involved in glucose and appetite regulation, and its functions are very complex and interconnected with many other hormones and psychological or physiological processes, in the bodies. Due to its important role in glucose metabolism and appetite regulation, GLP-1 has been a target for the development of numerous medications actually used in the management of type 2 diabetes and obesity. So medications like semaglutide mimic the effects of GLP-1 and are used to control blood sugar levels and promote weight loss in certain individuals. So this is why I brought Tifany on. Tifany, can you discuss how semaglutide mimics these effects and how it's administered and titrated?
Yes. So, for first of all, great explanation for GLP-1s. And so I've been prescribing GLP-1s in my clinic since 2021. So going on a full 2 years now, the summer. So I see what the research shows and the clinical trials show, and then I also see what I see on a daily basis with my patients. And this medication, this class of medications has definitely been a game changer for weight loss in general. In the past, most of our weight loss medications came with some type of risk, mostly cardiovascular risk. And this medication has been shown to decrease cardiovascular risk because it is mimicking something that we naturally have in our body. So it is the closest thing that we have. Well, it is considered a form of a peptide, and the peptide that many people know about is collagen. So I always give the example, science is always evolving and improving, and we are able to take something that we have in our body and mimic it in a lab and then give it back to our body. And collagen is one of those. We stopped producing collagen in our early 20s. We literally can only get collagen in our body again and in our skin by ingesting these peptides or putting it on our skin. So that's one of the most known peptides, but science has evolved so much that there's almost a peptide for almost every cell that we have in our body to reproduce. So all that being said, GLP-1 is one of those that they have figured out how to mimic. And because it is so similar, it has decreased a lot of the side effects that we usually have with weight loss medications. That's why it's such a booming topic right now, because weight loss drugs aren't new. We know that. But the fact that it's able to help cardiovascular risk and get these patients losing weight, that's just a complete game changer. So semaglutide is the one that we'll discuss today. And semaglutide comes in a few different forms. The most common is the injectable form, which is usually subcutaneous. Subcutaneous means just right under the skin, right into that fatty tissue. So not a deep needle, very, very small. Originally, it was for type 2 diabetics, like you discussed, under the brand name Ozempic. So when it was approved for type 2 diabetics, that dose is about 1 milligram per milliliter. Whenever endocrinologists and primary care physicians were like, okay, these diabetic patients are losing weight, their blood pressure is improving, their overall cardiovascular risk is improving, like what's going on? A pharmaceutical company went to the FDA and asked for a trial for weight loss outside of type 2 diabetics. And that is how Wegovy was approved. Now, Wegovy, it's still semaglutide. It is the same medication. It was just approved by a different dose and for a different reason. When it comes to the FDA, every brand medication has to be approved for its specific reason and a specific dose, which is why even like ibuprofen and acetaminophen can be approved under different brand names because it's for a different reason and a different dose. Same thing happened here. The Wegovy for weight loss, Wegovy weight loss, That one was approved at 2.4 milligrams per milliliter. So the dose is over double, and you do not have to be a type 2 diabetic in order to take that medication. So the clinical trial ultimately resulted in about an average of a 15% body fat loss, body weight loss, which at the time was thought to be comparable to some bariatric surgery results. And so, with that being said, obviously, a non surgical option is great to give our clients before just automatically going straight to surgery. So that was a huge win. Um, what happens in these type of trials? They're called step trials. So there's step one, which is the original trial, and that one lasted the full 52 weeks, which is a full year. Those patients stayed on that medication for the entire year. Then they follow up with the patients. So step two is following up after a year. Step three is following up after 2 years, and they will continue to follow these patients to learn more about the long lasting effects of the medication. So what they did find is the longer that you are on the medication, the less likely that weight is to come back. Because as we know with weight loss medications, that's the biggest risk, is that yo-yo effect. Yes, that medication will help you lose weight significantly, but how will you maintain it once you get off the medication? So that's what these trials, and then adverse effects, side effects, like they continue to study that. So it is important to know that this medication is still in step trials, but it is actually approved by the FDA. Um, Dosing is usually done via titration, and titration just means that we start at a lower dose, and based on how the patient reacts to the medication, based on their results, side effects, if any, things like that, that helps us determine what the next dose will be. And personally speaking, as a provider, I like the lowest, most effective dose. I feel there's no need to go to the maximum dose if my patient's having great success at a lower dose. So I titrate on a weekly basis, and they stay in contact with me on a weekly basis until we get them to a dose where they are like, okay, I'm getting all the benefits of the medication. I don't need to increase anymore. And we just stay there. So we stay there until they reach their goal weight. How long does it take to reach your goal weight? Well, it depends on your reason for being for your reason for it being difficult to lose weight. So your reason for weight loss resistance. As you mentioned, the medication works in three different ways. It's going to slow down, slow down how much you eat. So, and it's going to slow down the emptying of your stomach, which results in you feeling fuller longer, which slows down how much you eat. So if your reason for weight loss resistance is overeating, then you'll start to get those results as soon as that part of the medication kicks in. The second way is that it's going to block a hormone in our brain that is responsible for us being satisfied with the food that we're eating. So if your problem is snacking and craving, and I just have to have my potato chips and I just have to have my ice cream after dinner, then as soon as that hormone is blocked, you're going to see a significant decrease in your weight. The third way is it actually helps your body's natural production of insulin. So if you are a patient who is on the borderline of pre-diabetic, or you are diabetic, then the minute that your body gets enough of the medication to catch up with its normal insulin production, then you're going to start seeing that weight starting to drop off. So everyone is different. I tell everyone to give the medication at least 6 months. That doesn't mean that you have to be at the full dose for 6 months. It doesn't mean that there's so many different ways. That's why I always recommend people go with providers that are going to actually be in the program with them and not just prescribe and go, because your journey may look different than your neighbor's journey or the TikTok influencer's journey that you're watching. And so I don't want you to get discouraged, because it is a great addition to anyone's weight loss journey, but just understanding how it works is the key.
Okay, wait, 6 months is a
Yeah.
long. So are these people, is there a requirement that they have to be so many pounds overweight or over a certain BMI to be on this?
To start it, yes. Once they're on it, though, it is up to the provider to determine how long. If they drop below the BMI, it's kind of a clinical decision. talking to that patient, knowing where they are mentally, emotionally. There's a lot that goes into weight loss. So it's not a hard cut answer on as soon as they drop past that certain BMI that they have to stop the medication. Um, 6 months for a weight loss medication is actually a short term. So that's why these yo-yo effects happen.
Mhm.
Is like phentermine, for example. We historically cycle patients off of that medication because it is a stimulant, and so it has a risk for addiction, dependency. So we cycle those patients off because of that side effect. But the GLP-1s don't have that side effect. They don't have that, they don't carry that same risk. And so again, it's also being shown to help with cardiac health in general. And so there's no research as of now to suggest a limited time that the patient can be on this medication.
Well, and I like that you can titrate down and figure out
Yes.
dose for long-term
Yeah.
ability.
Right. So, anecdotally, so in my practice, I'll speak about how we do it. So, once my patient pretty much gets to their goal weight and they're feeling confident in their lifestyle management, which we'll get into later, then we have a discussion. And I usually say they're taking 60 units. So, the maximum is 2.4 milligrams. So, say they're taking 1 milligram every week. And that got them to their weight loss goal. Then we discuss, okay, let's titrate down to 0.25 milligrams or maybe zero point 0.5 milligrams. Let's get you there. And then let's cut down the frequency as well. So I'll first titrate them down to a lower dose, and then I'll titrate them down frequency as well. So instead of giving an injection once a week, we can do every 2 weeks, every 3 weeks, or something like that. What it does is that the biggest issue with this medication when people come off of it is the hormone block, the blocked hormone that's responsible for you enjoying what you eat. We live in America. We usually eat food for how it tastes, not for the nutritional value. That is unfortunately our culture. So to have that blocked, to be able to eat for nutrition without having to practice the discipline of eating for nutrition, that is a game changer, and that becomes very easy to get used to. Once that medication stops blocking that hormone, and now that pizza looks delicious, the same pizza that you fed your kids for the last 6 months and you never had a slice, now that hormone isn't blocked anymore, you're going to eat that pizza if you haven't practiced the discipline, if you haven't been told that you have to practice that discipline while you're on the medication, you know? So that is how people slide back. If they practiced meal prepping, incorporated some physical activity that they enjoyed and it didn't feel like a chore, then they are more successful at staying off the medication and not gaining that weight back.
And that's like the underlying theme in any of these weight loss prescriptions, injectables, even bariatric surgery is there's still this need
Yeah,
to learn and develop new lifestyle habits that you can take
correct.
with you, whether you're titrating to a lower dose or off completely. You want to make sure that you have those tools in place psychologically and other.
Absolutely. Hmm.
And I imagine price has to play a role in some of this as well, because I'm curious, I've heard different things, but how does insurance cover this? What does cash pay look like? And I'm sure that goes up as you're titrating up and down doses.
Yeah, so insurance will always be about 4 to 5 years behind any new medication. So some people are getting these medications approved if their insurance plan includes obesity management.
Mm.
The only other way to get it approved if you do not have obesity management coverage is you qualify for type 2 diabetes or pre-diabetes. Um, Even then, your provider will have to do a pre-authorization, kind of fight with the insurance company. So that is the downfall. I have had a lot of patients come to me. My practice is cash paying only. So I have patients come to me that they got approved for 3 months. And then after that, their insurance company stopped approving it. So then they are left feeling good about themselves because they've lost 10 pounds or so. and now they can't get the medication anymore. So it has been proven that the insurance is just it's that answer that no one likes, but it depends. Without insurance at retail pharmacies, you're looking at about $1,500 for about 4 to 6 weeks of medication. That is how compound. So a lot of people are accessing it through what's called compounding pharmacies. Um, Compounding pharmacies have been around for decades. It's what we as providers have used when we need to prescribe a medication and say a patient is allergic to a specific part of that medication. So it's often used in children. Say we need to prescribe an antibiotic, and the manufacturer that normally would make that antibiotic in a retail pharmacy uses red dye, and say the patient is allergic to red dye, or the parent does not want their children to have dye. We would place that order at a compounding pharmacy where they have the raw material of the antibiotic. So that way they can make that same antibiotic without that dye.
Mm-hmm.
All right. So that is what compounding pharmacies have historically been used for. We also use them for creams. Dermatologists love to send their creams to compounding pharmacies because they can mix this with this and keep the steroid out. Like there's so much you can do because the pharmacist there is actually making the medication from raw materials. So semaglutide has been available for a lesser price through compounding pharmacies. Some providers, if you go on social media where a lot of people get their information right now, some providers will have a negative outlook on compounding pharmacies, say that they are unsafe and they're not regulated and all of those things. And that's not true. There are some compounding pharmacies that are not regulated. You do have to do your research, but most compounding pharmacies are more sterile than retail manufacturers that are producing these medications in the masses. So, and a perfect example of that is that some of the manufacturer for semaglutide, they got flagged by the FDA and had to throw out a whole lot of their supply, which is why they are short supply for the last 2 years, which the FDA approved compounding pharmacies to fill in that gap while the semaglutide is on back order. So if you come across a clinic that is offering semaglutide from compounding pharmacies, it is FDA approved as of today's date of this meeting that we're having. It's something that'll continue to change as the suppliers get off of the shortage list, which I don't see happening anytime soon.
Okay, so my next question is, can we use this in combination with other diabetes medications?
So if a patient is type 2 diabetic and taking another medication that is not in the GLP-1 family, yes, it is not advised to take 2 GLP-1 medications. And it is not advised to take it if you are a type 1 diabetic.
And what about breastfeeding?
It is not advised to take if you're breastfeeding.
Okay, okay.
Yeah, so some of the biggest contraindications is pregnant. If you plan to be pregnant, I tell my patients within 6 months, we don't want to take the medication. Breastfeeding, type 1 diabetes, kidney disease, liver dysfunction, that a history, personal or family history of medullary thyroid cancer. If you have what's called, sorry about that, Siri's always in my
Always
business,
interrupting.
always has an answer for something. If you have a specific type of history of an endocrine tumor, if you're under BMI of 26, I think it's 26 or 25. Those are the biggest ones. Yeah, those are the biggest ones. I always do a full set of labs on every patient that I start this medication on because unfortunately I have had patients who do have some type of kidney dysfunction that they just were not aware of. And so we go and dig deeper into that before starting the medication. So whoever you go to start this medication, I highly advise that you make sure that they check your lab work, because the biggest adverse effects for this medication, so side effects are things that we expect to happen and we manage them. Adverse effects are things that we know can happen, but we do not expect them to happen, right? So side effects are GI related for this medication: nausea, indigestion, vomiting, um, constipation, and diarrhea. Those are the biggest ones. Fatigue is another one that unfortunately it's very hard to battle that one, but there are ways to, but fatigue can happen with the medication. Adverse effects are pancreatitis and gallstones.
Mhm.
So there's ways to screen for that, which is, do you have a history of gallbladder disease? Do you have a history of pancreatitis? If you do, you should not take this medication. Also, you should get baseline liver enzymes checked before you start the medication, because the symptoms of gallstones and pancreatitis is very similar to the side effects of the medication. So if you're telling your provider, I'm feeling stomach pain, I'm feeling nauseous, I'm feeling tired, they may say that that's just the side effect of the medication. But if I get one of my patients saying that and it's enough for them, and I question them, I ask follow-up questions, and now I'm concerned about potentially early pancreatitis or gallstones, I can lean back on my lab work. I go ask them to get lab work completed again. We review it. If there's absolutely no change in the liver enzymes, then it's most likely the side effect. But it's good to know to have that as a screening basis.
Okay. Okay. So key takeaways is this is a prescription medication. It has to be prescribed.
Mhm.
The
Yeah.
good news is that although it's on back order, there are compounding pharmacies that are FDA approved. And while there are side effects and adverse effects, they're easily managed with proper screening. And we're using it for diabetes and weight management now, which is good. And administration sounds relatively easy if you're up for a needle.
Yeah, but the needle's so tiny. So my practice is completely virtual, and I provide them with the resources to self-inject. And I even do visits with them virtually for their first injection if they need it. But usually the people that say like, yes, I want to do the virtual visit, once I give them the resources, they're like, oh, I actually did it. It wasn't bad. So
Yeah.
it's super easy to inject. I mean, the pros outweigh the cons usually for those that are afraid of the injection.
And it's a once a week injection, right?
Once a week injection.
And aside from the weight management and diabetes, we're also seeing the cardiovascular benefits, which is huge.
Yes, yes. So a lot of patients come, which it matches when you have weight loss resistance. A lot of them have um
Like a metabolic
what
syndrome.
is it?
Com-
Yes, like their lipids will be elevated, their LDL, HDL, all of it.
yeah.
Yeah, high blood pressure. And so I for sure track it, but the research has tracked it too, that all of that improves. The longer they're on the medication, all of that improves.
Well, and that makes sense with weight loss. We're going to see improvements in all of those metabolic
Yeah,
factors. So,
yeah.
oh, some pros, some cons would be the gastrointestinal side effects, maybe the cost, insurance coverage.
Mm-hmm.
Um,
Yeah.
we're getting more long-term data, so that's good. It may not be
Mm-hmm.
suitable for everybody, but with proper screening, I think we can figure out the best fit for everybody.
Correct.
Um, and I think the last thing I wanted to know, so this is an injectable. Are there oral like tablets or capsules that they can take, maybe a different brand?
Yes. So the brand name for the semaglutide tablet is called Rybelsus, and it comes in different dosaging, obviously, because it's a tablet, and the frequency is given daily instead of weekly. So it's a daily tablet. Um, that one has been right now the most expensive option, but if someone's just absolutely cannot fathom injecting themselves once a week, it is a good option.
Right. And I think we have to emphasize heavily the need for dietary and lifestyle management while you're going,
Yes.
6 months to a year and you come off of this. We don't want you to rebound and have weight gain and the development of these comorbidities. That
Yes.
we're working with a
Absolutely.
professional can help you establish those dietary, necessities, meal plans, and figure out your macros and what your plate should look like. And I think also learn the flexibility, everything in moderation. Everybody's very unique and different, and depending on what all you have going on, as far as like other conditions, it's important to eat based off of your health and your unique
Right.
needs.
Yeah. Yeah, I completely agree. We are in a era of information. So there's so much information available to everyone that it is easy to look at someone, decide that that's how you want to look, and then take in everything that they say and do it just like them. And then you end up feeling disappointed because you didn't get the same results that they did. And I've seen that. And so, working with someone, working with a nutritionist, working with a health coach, someone that can get to know you on a personal level and know your entire picture and not just that you're trying to lose weight,
Mhm.
right? Like we need to understand, what does your day-to-day look like? We need to first see obstacles in this process so that we can give you the tools that you need to address those obstacles, to overcome those obstacles when you're confronted with them, so that you don't feel defeated, right? So that is exactly what everyone needs during this process, is outside of the medication, which is something that a provider can provide. What else is in that program? Like, what are the other, either the provider can offer that, that accountability, that support, or do they have anyone in their program like you that can walk a patient through step by step what they need for habit changing, because that's a huge one. We are creatures of habit, and there's a lot to be said about the psychology of losing weight. And a lot of us focus on the physical side of losing weight, but a lot happens psychology and in our minds when we lose weight. And once we get to the goal, what happens there? So having someone in your corner that can walk you through that is the make or break of your long lasting weight loss results.
Yeah, I think there's a lot to be said about the psychology. And I think that's something that I practice day in and day out with coaching my clients. It's
Hmm.
learning their schedule, learning, what time are they waking up? What is their job? What stress factors do they have playing a role in this? How are they sleeping? What are their hormones look like? What's their gut
Yeah.
health like? I mean, there's so many factors, and what works well for one person may not work well for another person. So,
Exactly. Yeah. And so one of the examples that I give is, I know you do elimination diet and food sensitivity testing to determine if there's any foods in someone's diet that is causing them constant inflammation, because with constant inflammation, they're not going to lose the type of weight that they want to lose. So, say when we can use me for an example. My food sensitivity test says that I need to stop eating beef. Okay. I love beef. I love it. So the idea of me having to stop eating beef makes me want to not even start the program in general, right? I'm just like, you know what? I'll just be exactly how I am. It's fine. But the way this medication can help with your lifestyle modifications as you go through it is, when I take the medication, that hormone is blocked for the things that I actually love to eat. So now I don't really crave the beef. I don't crave the oxtail. I don't crave the steak. So now I can focus on what I can eat without feeling like I'm depriving myself. So that's the true, like, testament to what this medication can do for the long term, is you can use it as a crutch and the while you initiate the actual lifestyle changes, you know? But if you use it as the full-blown vehicle to get you where you need to go, eventually it's going to break down. But if you just use it as just a little crutch while you do the hard work and you work, walk slowly,
yeah.
then you will have long lasting results. I hope that made sense, like
Yeah,
it
it's a
came in my
tool.
brain.
It's a
Yeah,
tool
that's all it is.
like that. And I think it's important, some people may be confused why I'm talking about a prescription medication when I'm a functional medicine nutritionist, but people need to understand that this is a collaboration between different providers, and my
Right.
job is to work collaboratively with different physicians of different specialties, sometimes multiple specialties for one patient,
Mhm.
to help them
Right.
be successful. And if this is the decision and the tool that they decide that they need to
Mhm.
obtain their goals, I'm here to support that. And I think it's important that we
Exactly.
all understand the pros and the cons, And I think, the takeaway is that it's essential to have a thorough discussion with your healthcare
Mhm.
provider and your healthcare team about
Yeah.
the potential benefits and drawbacks of something like semaglutide in your specific situation. And they can help
Mhm.
you make an informed decision about whether this medication is an appropriate treatment option in managing type 2 diabetes or your weight.
Right.
Awesome.
Completely agree. Completely agree.
Well, thank you so much for your time. I appreciate your expertise and your experience in this area. And if anybody needs information on how to reach Tiffany, I'll be linking it in the show notes so you can follow her and get more information if you're interested in this particular prescription.
Awesome. Thank you so much for having me. This is so important. I absolutely love what you do, diving deep into finding the actual root cause. And I think there is a lot to be said in the integrative medicine world where functional medicine and prescription medications can come together for the patient's best benefit. With me personally, my goal is to always get them off of medications in general. So thank you as well for providing this opportunity to educate. I know a lot of people are interested, and so getting information from people who are not just patients, other patients that are taking the medication is always beneficial. So thank you for having me.
Awesome. Thank you. Thank you for listening to the Sky Therapeutics podcast with your host, that's me, Tara Torres. If you enjoyed today's podcast, be sure to check out any bonus info and links in the show notes. You can visit us at www.skytherapeutic.com or find us on social media because we love connecting with our audience. Until next time, be well.